I would like to thank Dr. Tanya for sharing the slide with me. So anything that you are not sure later on, you let me know and then I can explain in detail. Yeah, okay. So Dr. Tanya have presented this in 2022. Yeah, okay. It's also under our department. Yeah. Okay, so what is survival analysis? Because when we talk about survival means how long patient can live, right? Or how many event happen, how many death or outcome event. So when we talk about outcome event, it really depends on your study. Because if you want to talk about survival, normally we take 5 years, right? So if you start your study as a prospective study, you cannot get survival for your research, master research, because your master research only 4 years, right? You cannot use that unless you are using retrospective data. Yeah, retrospective meaning you already have a database or registry, then you can use that to record, to retrieve all the data from that registry, and you run a survival analysis for that and see your patient, how long they can live, and 5 years time, how many can live under your treatment. Yeah, that's we call occurrence of event. Event means a life or death. Okay, so it's an outcome interest, and we are looking at time to event. We are not looking at we call retros what we call cross-sectional study, how many die, how many survive. We are looking at the time. So you want to look at 5 years survival, 5 years occurrence of event, or 10 years. Okay. So like what we say when we talk about this thing, you talk about disease, right? So when you talk about disease, you want to know with this treatment or without treatment, what is the survival? Yeah, it's like we talk about some lymphoma disease. Their survival 5 years is 21, 0.21 means 21%. Yeah, okay. So in clinical setting, we use this survival analysis for cohort study or randomized clinical trial. Yeah. So the objective of doing this survival analysis in your research project, because we want to know, we want to estimate time to event for a group or for two group of patient, right? Or two group of individual or subject. Like, let's say we are talking about heart transplant, how long they can survive, yeah? Time of their disease remission until they develop the problem, yeah? So also we want to compare two group. We can do on one group and we also can do on two group. Yeah. So two groups, sometimes we talk about you are using some drug. Like our oncological drug, we talk about Avastin treatment for this disease, right? So how soon this patient develop problem and become I mean die from the disease itself on top of the treatment. Yeah. So we want to see that whether with the drug they survive longer compared to placebo or standard of care. Yeah. So we use this survival analysis to find out. And we also want to see prognostic co-variable, means what is the factor affecting the survival as well. We can have a look on age, menopausal status, or ethnicity, which is you cannot change, but whether it changed the survival or not. Yeah. This can be done using survival analysis. Yeah. So the term survival analysis is we are looking at two things. Yeah. Time to event. Yeah. So when we analyze the data, we need time, we need duration. Yeah. So how is your follow-up from the time of diagnosis or the time of start of treatment until the event? Like you want a 5 years or you want a 2 years cut-off point, that is the time that you are looking at. And we also want to censor out those who like loss of follow-up, those drop out from our study, and also before the study end, before they die, or all this outcome, we want to censor that out before we do the analysis of survival. Yeah. So if every patient is followed until death, right? So the curve may be estimating simply by just computing the fraction of survival at each time. Yeah. So that is the clue, and that is a way to do analysis, survival analysis. Yeah. Okay. So why we need to censor or do censoring? Yeah. Because when our data have more than 50% censored data, means the patient died more than 50% before our limit time, or all drop out, or you cannot loss of follow-up, then you cannot do analysis for this. So that's why very important, when we do the analysis, before that we need to screen how many percent of patient drop out or missing from our research. Yeah. So that is very important even before you do the analysis. Yeah. Okay. So by theory, right, you can see survival function, we call it S. Yeah. S survival on the time period that we want. Yeah. ST. Yeah. So it's number of patients survive longer than T over total number of patients, right? That means the total is a probability of patients survive over that time. Yeah. So at T equals to 0, right? The total number of survived patient is 1, means 100% survive. Then when we move down slowly, then we might reach at the end, like nobody survived after 11 years or that, no? That one will become 0. But most of the time, it won't go to the 0 lah, yeah? So there's still people or patients survive. Unless we censored out all the loss of follow-up, then we don't have enough patient to analyze really, yeah? And inside this survival analysis method, right, we can do life table. We need to use the life table to see the interval. And we also can see the Kaplan-Meier curve. We can see from time of 0 means the start of the study to some length or duration of a study. Yeah, Cox regression is the one that we are looking at. What is the factor affecting the survival? Yeah. So why we use this? Because it's very difficult sometimes when we do research, patients tend to drop out first thing, right? That is quite common unless you really chase the patient, follow up the patient tightly. And when sometimes they also lost of follow up, or they move away from the area that you are doing a research, then you will lose the patient, right? So from this Kaplan-Meier curve, actually they help to censor out those who like already drop out. Then they give you an overall picture, those who like around, what is the outcome from that, yeah? So it always used to compare two group, yeah? And very easy to do if you follow the steps, yeah? And it give a more non-parametric type of estimate, means it's not a continuous data. Is a categorical data, yeah? So you can see here, when you start to do Kaplan-Meier curve, right, you need to have two groups normally lah. If you have one group, also possible, and you are not comparing, you only want to know this group of patients, how long they survive, yeah? Okay, so when we do, you can see here, we always look for two things. Step function means here, the whole thing, the curve, and median survival time estimate means on the when is the time that the population that you are investigating survive, when the population remaining 50%. Yeah, maybe you have 100 patients, then you follow up them for a couple of years, like 6-7 years. Then you want to see which timing, like which time 50% of your patient only already died, remaining 50, right? So every curve is different. So how you do is you draw a 50% line here, then you draw the one that crossing over the median survival line. Yeah, here. Then you go down, then you know, oh, the median survival for this group of patient is about 11 weeks. Yeah, okay. So you can see if we talk about two group, then it will be like that. Interventional, control, like that. Yeah. Okay, so when you touch here, right, means the whole group, 100% of them, I mean, no, not around anymore when you reach 300 times means not sure. This time maybe can be minutes, can be hours or that, yeah? Okay, so for this green group 2, yeah? Where else you can see the red one still surviving even after 350, yeah? Okay, so how this work? Let's see when on each interval. Interval means the timing here. Interval here. Huh? One is interval, interval like that. Yeah. So we look at first interval. So we are doing 8 patients plus 3 being censored, right? So from there we know 5 are at risk, but 1 died. So survival is 4 out of 5, 80% at this time. Yeah. So alive 4, censored 2, right? So this censored one we cannot count anymore. We only can count alive, at risk, and died is 1, right? So we move on to another timing, the time. Then we see 2 at risk, 1 died, 1 alive, right? So 1 out of 2. So 50% survival at this timing, yeah? So you understand, you need to censor out, and the censored patient or drop out, loss of follow-up won't be count in the survival. Okay, so how does this work? Actually, is survive. Kaplan-Meier meaning is like looking at probability of surviving at certain point, like estimated by cumulative probability of survive of each time interval. Yeah. So certain point you're looking at maybe 2 years down the line, how many survive? 4 years down the line, 5th year down the line like that. You don't go, you also can look for first 5 years, how many survive after your treatment, right? Yeah, all this. And when we estimate, we are looking at estimation, right? Estimate only, no, actually it's not actual. So we want to calculate the survival at certain point that we are looking at cumulative type of survival, right? You can see P1, P2, all that. So how to compare survival function? Yeah, survival function. So now when we see this, right, these two group, so you don't know whether they are significant or not, no, the difference in survival. So how to do that? When we calculate this one, right, we need to have hypothesis. Yeah, the null hypothesis is both survive the same. Yeah, the alternative is they are survive different, one group better and one group better at certain point, and then one group same when they go further, all that. So all this is null hypothesis. So how are you going to accept hypothesis, your null or your alternative? Yeah. So when the p-value or log rank analysis say more than 0.05 means what? There is no different, right? No different means you are accepting null hypothesis. So when p-value is less than 0.05, there is different. So you're accepting alternative hypothesis. Yeah. Okay. So let's see here. So when we look at this, right, we don't know, no, we don't know this one, whether they are significant or not, right? So that's why when we analyze the overall survival, we need a log rank test. So log rank test is going to tell us from this, what is the log rank test p-value. Yeah. Okay, so when we calculate also, we have to also understand there's few things you need to know. First thing, the follow-up time and data calculation, because we need to know the interval between the date of diagnosis or date of start of your treatment to the date of last outcome, whether they die or survive, right? So you need to have that. And then you also need to have proportion, yeah? How many survive, number of subjects, and calculate through here. All this will be done by our SPSS, yeah? Okay, so what is a limitation using Kaplan-Meier? Yeah, so if our censored observation less than more than 50%, then we have problem, right? We need to have a uncensored observation more than 50%, yeah, your intervention group, yeah. And you also sometimes median survival time difficult to find, doesn't control, means it doesn't adjust by any factor. It's just a overall survival like that, yeah. So, and we also assume the sensory occur independently from survival time. Means patient, like if patient develop adverse effect due to the treatment or live or forced to live or die, that one we cannot catch. Yeah. So that is the reason that they might have every analysis, we need to have some certain condition. Yeah. Okay, so when we talk about factor affecting survival, yeah, so let's think about, okay, let's say I have a cancer patient, right? So they are on treatment like what we call tamoxifen, letrozole, or any drug that ongoing using. So we run a trial on that. So when we do the trial, right, we know there might be some confounding factors, might be have some bias in it that you cannot change. So sometimes we can use that and find out what is the things that affecting your survival. Okay, so to do that, first thing you need to adjust your data. So you need to find out what is the analysis that you are going to look for, which one is what we call significant factors, or anything that we draw a limit for the p-value lah. So from there, you can pick up some factor to put into your model. So this model we call Cox regression. And if we don't talk about survival, then we call it regression model. Yeah. So there's a little bit different between hazard ratio and regression or odds ratio. Yeah. So let's say, so when we talk about hazard ratio, so you have to deal with survival, with time duration, as well as factors, and how these factors affecting survival. Yeah, how many percentage of our ratio? Yeah, so if you talk about just odds ratio, means no affecting about what, it's just we are talking about this event, this problem, like we talk about colon cancer problem, then we want to find out whether diet is affecting or not, race is affecting or not, but we can't say if affect the survival. It just become part of like bias or part of the factor that we need to take into consideration. Yeah, okay. So hazard ratio is for Cox regression because we are looking at the factors, whether they can affect our survival or not. Yeah. Okay, so now we will look at incident, yeah, hazard rate, incident. How many percent of this causing uh, new cases? First thing you need to know new cases first, how many you have. Then only you move on to how to compare the group, the two group, or the group with going to analyze for survival with some factors inside. Yeah. So you can see here, logistic regression is just aimed to look for odds ratio, the difference between two events. Yeah. Okay, so when we interpret our result, right, when we have already a result of Kaplan-Meier survival, then we need to explain like this. Yeah, you have a look. So when we done our SPSS analysis with our data, yeah, you can see here, how can we answer the question of survival? Then we need to have the figure like just now with a 2 of 1 like Kaplan-Meier curve. Then we also have to look for the table, survival table, to look at median survival, which is like the 50% of the cumulative, and when is the time of median survival time. Yeah. And we also can see our log rank test, whether this two group is statistically different or not. Then we have to reject our null hypothesis. Yeah. And hazard ratio from there. So we can see B, exponential B. Yeah. Okay, so from here you can see this is few tips that we need to know. So when we take the survival analysis to estimate the time to event for a group and to compare time to event between two or more group, we can use this, yeah? And the data, we need to transform them to censored and uncensored, yeah? And also we need to understand the outcome of interest uncensored, yeah? And if we cannot achieve outcome on the date that we want, we call that censored data, yeah? And when we do Kaplan-Meier estimation, we are estimate percentage probability survival at each time point, yeah, like 5 years, 3 years, or 10 years, yeah. So what we are looking at as well, we need to have an interval, yeah, the start of interval and the start of new class interval, all that, we need to have that. And we also have to add in log rank test to compare two group, yeah. And also we have to control the confounding, yeah, by looking at Cox regression, yeah. Okay, so thanks. Like, let's do what's that called, hands-on, yeah. Okay, let me check here. Unshare the thing first, then let me open the. Okay, so I have a file here, yeah. Let me see, let me share first, share screen. Okay, I have adjust a little bit on this folder and the file. Can you see? Can?
Yeah, Prof. You can see, your
Yeah,
active.
okay. So I bring the one that we need to use for our analysis to the front, yeah? So you can see here, first one is follow-up duration. So we need this. So how can we generate the period or duration? We need to go back to date of diagnosis to date of death. Okay? So before we put date of death, right, we need to make sure we sort them first. This one is confirmed death, right? Yeah. But those survive one, this one alive, you can see my event alive. So we need to put the date that your cut-off date. Let's say your cut-off date is your analysis is by the date of 31st of December 2024 this year. You want to clean up all your data, and then whoever survive, you put a date for that. So you can put here 31st of December 2024, yeah. So this one you need a cut-off point for those who are alive lah, huh? If not, then you got no aim, right? So if you want to continue doing for the next 10 years, then you have to put a 10 years one, yeah. Okay, so we move down until the end, all alive, right? So I paste the same date here. Okay, this one repeat. Maybe I have to take out later. Okay, just pretend this one is okay, right? Yeah. Okay, can see here. So you need to have date death and date of diagnosis. Yeah. So what you need to do is you transform. Okay, this one is how I get this follow-up duration is the way is transform. Then you get the date and time visit. Yeah. Okay, you choose the calculate with dates and time. Okay, if you all cannot see, please let me know, yeah? Then you choose next. And you want to calculate the number of time units between the two dates. You click this, then you next again. Okay, so date 1 will be date of death here. Okay, date 2 will be date of diagnosis. Okay, so you need whether you want to count months, weeks, also possible. You choose months, yeah. Truncate to the integral, round, you do round, okay. And then next, and then you put the result there, unit, yeah, okay. Follow up period. Period of follow up. Okay. Then after that, you click finish. Okay, so you go to the end of this slide and there you can get your result at the end, this one. So it's according to months, yeah? So this is the result that you need to use during your survival analysis, yeah? Okay, so to start survival analysis, you need to make sure you have an event. Here, event, event means alive or death. Okay, so here I already categorize them here. So alive will be 0, death will be 1, because you want to look for death, right? Correct? Okay, make sure all fill up, yeah? Event like latest, I'm going to use this. So now to analyze the overall survival, you go analyze, you go survivor. Okay, you can see here you got 4 choice, right? So if you want to look for Kaplan-Meier curve, all that, then you go to Kaplan-Meier. Okay, if you want to do a Cox regression, then you go to Cox regression to fill up with some other factor. Yeah. So let's talk about plain one, overall survival. So you go Kaplan-Meier. Okay. So time. Time will be the duration that just now we calculate out one. Period of follow-up you have to put here. Okay. Status is the one that just now I said event last. Event latest. Yeah. So I put here. And I need to define here single one. One event is one. Correct. Event is one, yeah. Date is one, yeah. Okay. So after that, the rest, I don't think you need to add. Then survivor, you want cumulative event. You can click all first and have a look, or keep the hazard, yeah. Because I'm only using okay, factor I forgot. Okay, factor, right? If you have 2 group, you already categorize them, then you put this over here. Otherwise, they only screen the whole group without comparing 2 groups. Yeah. Okay. I don't put the recon first. Then after that, the rest survival table you want, mean and median survival. Then you want them to plot for you. Okay, continue. The rest is here. Okay. Yeah. So I run okay. So can you see here?
Yeah, I can see it. What about the rest?
This one. Go to output, right? Let me see. Output should be this. Go to output. Okay. And this one. Okay, let's see. What's wrong? Okay, I stop share first. Wait. You need to go to the output of the analysis. Yeah, here. Yeah. Okay. This is a survival table. So they will tell us how many I'm investigating. I got 760 cases. And number of events means number of death is 103. Censored 86.4%. Okay. So time. So now we are starting looking at our time. So you can see here. So we are talking about months, right? So just now I put months. So if we are talking about 5 years, it will be 50. Let's look at 50. 60, sorry. 60 will be 5 years here. So looking at here, right? 60, your survival is about 87% here. Okay? You can see, because here don't have anything means you have to refer to the above. Okay? So if like, let's say we talk about 10 years, 10 years will be 120. So you look for 120 here. Yeah, this area, 120. I don't have any result here. So you have to move up the one that have above. Here, 86%. Okay. So this is your probability of your patient survive what's that called? According to years. So you move down, then you can see here. This is your mean with a 95% confidence interval. Yeah. And then median, let's see. This is one curve only, okay? And if you want to do log rank, then you need to click something. Let me see. Log rank, survivor here. Okay, let me see. Let me use this. If I don't, normally log rank will come out straight. let's see here. I take this duration, time, status is latest event here. Then I define one. Is survival. Method. Save survival function. EI is here. Okay, that's all. Oh, sorry. Log rank, you need two group. So because we only have one group here, so I cannot see log rank, right? So if I want to put two group, I can do this as well. You see, survivor, Kaplan-Meier, and factor. I need to put the recon type because I have two group here. So I need to compare the factors. So log rank here. See whether the survivor for these two group have any difference or not. Yeah. So I do this. Yeah. So let's go down to see the log rank result. Yeah. So log rank statistically not significant. 0.256 means the difference in these two survivor is no different. So we cannot reject the null hypothesis. Yeah. Yep. Okay, you can see here. Okay. So that's how we do for only survivor. If you want to talk about the Cox regression, you want to see factors, right? Actually, we need to check the factors first. How many factors that when you do regression, their p-value is less than 0.05, then you can use them as your Cox regression factor. Yeah. So how to do it? You go survivor again, then like just now, then you add the factors here. Maybe age is a factor, parity factors, so you can put them, categorize them. Yeah. So then from here, then you can do the categorical. If they are category, you have to move them here. Then only you click continue. All this is the same. Yeah. Then you move on and see yes. Then you have a look whether they affect. Here, you look at the last part. Here, not enough factors here. You can see this is like something like a regression, yeah. But you can have this exponential here. This is the one that's going to be your how many hazard ratio. So if let's say 2.875 means 2.8 times more causing death compared to the other group like that. Yeah. Okay. Okay, any question? Quite easy, right? It's just like you need to know the theory, why we need to do this, and in which situation you need to make sure your censored patient is not more than 50% or that, yeah? So that your result is accurate, yeah, valid. Okay. Any question for the rest?
Okay, any other question?
Are you okay with the can understand? Has it?
Hi,
Can
Prof. Sorry, can I just ask? So in in calculating survival analysis, I think from what I understand, we still include the censored observations, right?
we include, but the calculation, they know how to take them out,
Would
You still use all the rest, but they will censor out.
what if we? I mean, I wouldn't. What if we just completely exclude those?
Don't
Those
exclude.
patients?
Don't exclude.
Cannot.
They will know how to censor for you. Yeah.
Right. Okay, sure.
Yeah. Okay. Are you okay with that? Quite standard, but it's very crucial for those who do a lot of like retrospective data, and then you want to analyze, you want to see how long most of your patients survive, like stage 1 disease survive how many percent, like 5 years, how many percent of them survive, all that, This is the way lah. Today we are letting you know the general way and methods lah. Because SBS is very useful, but you need to know how to handle your data. Yeah, clean your data properly before you use it and calculate the analysis for survival. Yeah. So most of the paper you can see, like if you're dealing with all the cancer disease, all the drug trial, if you touch on this survival analysis and further move on to the survival analysis, we want to know what factor affecting the survivor and how much is the magnitude survive or affecting the survivor. So Cox regression is also come into the picture for that. Yeah. Okay. So any issue or later on when you have data, you need to ask us to help out. You can contact Dr. Gauri, Prof. Gauri. Then she will try to help out. And if really needs other people, then she will engage people for you. Yeah. So our team, our research team, hopefully can help you out to solve your data problem in future. Yeah. Okay.